طيب المرة الماضية كنا نحكي عن الجونادال هرمونز. اوكي، قلنا انه في عندنا hypothalamic pituitary axis بتحكم بالريليس اوف sex hormones اللي هم الاستروجين and progestin. طبعا قلنا انه في هرمون بنفرز من الهايبوثالاموس، اوكي، affects the anterior pituitary to release something called FSH or LH. Now, FSH, from the name, follicle stimulating hormone, it's important for follicle stimulation and for follicle stimulation, okay? And when follicle stimulated, one ova or boida will grow and mature, and then mid-cycle, menstrual cycle, بصير في عندنا شيء اسمه LH surge, which leads to luteinizing hormone surge, which would lead to ovulation. And then ovulation happens, and then the ova, fertilized, mature ova is released. And if like there was a sperm, then the ova would be fertilized, and then it will be implanted in the placenta, and then pregnancy will happen or conception will happen. هلا زي ما قلنا انه day 0 in the menstrual cycle begins صبيه لو تباعد بس الصبيه اللي جنب day 0 begins when bleeding happens, like when uterine lining is shed or it comes off or detaches from the uterus, and this is associated with concomitant stimulation of the ova to produce, like حكينا, one follicle or to grow one follicle. The follicle will, multiple follicles in fact would be stimulated, but with the physiological levels of FSH, only one would predominate. هون صبايا في هون قدام كمان تباعد now mid-cycle, which is on average is day 12 or 14, an LH surge, luteinizing hormone or hormone الإباضة, would happen, and this would lead to rupture of the follicle and release of the ova inside of it. Now, the ova is picked up by something called the fallopian tube. Fallopian tube هو بيكون على نحكي like picks up ova from both ovaries and then delivers it to the uterus. If there was a sperm, it would fertilize the ova, and the fertilized ova or zygote will be implanted in the uterus, and conception happens. Now, when the ova releases the follicle releases the ova from the ovary, the lining of the follicle converts to something called corpus luteum. Corpus luteum بسموه الجسم الأصفر, and this is responsible for production of progesterone. Okay, while the follicle during first half of the menstrual cycle is responsible for the production and release of estrogen. طبعا this is very important لأنه راح نشوف إنه في حبوب منع الحمل they have estrogen and progestin, and the levels of those they mimic this menstrual cycle in fact. Now, if conception didn't happen and estrogen made a thick endometrial lining to the uterus and progestin made vascular and نحكي mucus secreting environment that is suitable for the implantation of the zygote, but conception didn't happen, the endometrial lining will detach, and this is like what brings us back to the beginning of the menstrual cycle. So the menstrual cycle بتنعاد over and over. Now, we have many pharmacological products that are used for many indications. Now, first of all, you should know that gonadotropin releasing hormone which releases صبية تباعد. ممكن تيجي قدام هون. تعال هون. زي ما قلنا gonadotropin releasing hormone controls the release of FSH and LH. We should know that gonadotropin releasing hormone is not released in continuous way. It's released in pulsatile fashion, يعني in pulses. يعني pulse like spikes and then goes down. Spike and goes down. If you provide gonadotropin releasing hormone continuously, this would lead to during the first 2 weeks of administration to stimulation, and then it leads to inhibition of the system. And this is what they use for hormone dependent cancers. يعني لما يعالجوا سرطان البروستات او سرطان الثدي مثلا بيستخدموا gonadotropin releasing hormone agonists. Okay, هذول بيشتغلوا as agonists for the first 2 weeks and then they become antagonists. Why? Because they are administered كimplants. يعني زي زرعه بالكتف بيحطوها، وهاي بتصير تعمل ريليس للجونادوتروبين ريليزنج هرمون اوفر نحكي 3 months حسب البريبريشن الموجوده. في اشياء 3 months، في اشياء 6 months. هلا gonadotropin releasing hormone pulses زي ما قلنا controls FSH و LH release, and those will control follicle stimulating hormone, follicle production of estrogen or progestin later on in the cycle زي ما قلنا. هلا كل هدول الثلاثه they are found as pharmacological products. Okay. اول تنتين الجونادوتروبين releasing hormone we will discuss in a bit اللي هم هدول. They are the analogs or agonists, and now we will discuss اللي هو follicle stimulating hormone and luteinizing hormone. هلا زي ما قلنا this system اللي هو hypothalamic, pituitary and gonadal axis, those are regulated by something called feedback inhibition. معناته انه when estrogen is released in normal levels, this leads to feedback inhibition of both the hypothalamic and pituitary centers. Okay? هلا this is very important انه في حالة سن اليأس مثلا او السن الأمل زي ما بيقولوا المينوبوز, the they do not produce ova, but estrogen and progestin, and this would not cause feedback inhibition to gonadotropin release or the hypothalamic release, hypothalamus or pituitary release. فهدول الجونادوتروبين releasing hormone بالpost-menopausal women بيكونوا elevated in levels, they do not produce estrogen release, and then they will not cause feedback inhibition. So gonadotropin releasing hormone راح يكون عالي كتير باليونين of menopausal women. فعشان هيك they could extract FSH, okay, or FSH-LH mix from the urine of menopausal women. Okay, so menotropins are زي ما حكينا زي الميكانيزم اللي قلناها هلا او ميكانيزم اللي قلناها هلا هو mixture of FSH و LH, okay, that is found in postmenopausal women's urine. Okay, why? زي ما قلنا ما في estrogen released, ما بيعمل feedback inhibition للrelease of FSH or LH, so they acquire the urine and then they purify it. Okay, هلا urophilotropin, they only isolate FSH from the urine. يعني انه في عندنا FSH و LH mix, هدول موجودات مينوتروبين, و urophilotropin موجود فيه بس FSH. Okay. هلا you could also find مثلا products that are produced by recombinant human technology. يعني مثلا they acquire the gene of FSH and then they put it in Saccharomyces cerevisiae, which is the yeast, and they culture the yeast وبزرعوا الخلايا اللي هي بتعرفوا اليست اللي هو الخميرة. Okay, and they collect the products تاعتهم. So we have philotropin alpha or philotropin beta. هذول they are produced by recombinant DNA technology. هلا LH, okay, it could be found as recombinant form, but not يعني pharmacologically not found as يعني urine extract. But there is an agent called HCG, human chorionic gonadotropin. It's a hormone produced from the placenta, okay, اللي هي المشيمة, okay. If the zygote was implanted successfully, beta HCG or HCG would be released. طبعا beta HCG would go to the corpus luteum and stabilizes it. والcorpus luteum هو شو بصير فيه؟ It produces progestin, which stabilizes the endometrium كمان. Okay, so يعني لو نحكي beta zygote implanted in the uterus, okay, يعني this will grow into a fetus, and then the endometrial lining or placenta will start releasing beta HCG. Okay, beta HCG will go to the corpus luteum, okay, stabilizes it. والcorpus luteum produces progestin. طبعا this is very important. Why؟ حد بيعرف ليش البيتا HCG مهم؟ بيستخدموه كفحص للحمل. اوكي، فحوصات الحمل اللي هي بتكون urine tests, okay, they detect beta HCG. So beta HCG could be detected either by urine tests, okay, early and during the first 2 weeks of missed cycle إذا الوحدة ما أجتها الدورة, okay, and she could test for beta HCG using urine test. So if it was positive, then this could suggest there is pregnancy. In fact, they could really repeat beta HCG using blood workup. يعني انه فحوصات الدم بيكون more accurate than urine tests. هلا gonadotropin releasing hormones زي ما قلنا, they are released from the hypothalamus in pulses. They control the production of FSH and LH, and FSH and LH they control many functions. زي ما قلنا FSH in females acquired the name يعني FSH, follicle stimulation, while in males it controls spermatogenesis أو تكون sperms. On the other hand, LH in males it controls the formation of testosterone. هلا في عندنا many products. You could use those as pulses to يعني mimic menstrual cycle hormonal changes to normalize hormonal changes. طبعا هاي بيستخدموها قلنا ovarian stimulation protocols or ovulation induction protocols, انه الناس اذا كان في عندهم في صعوبه بالانجاب وكانت المشكله في الهرمونات هاي ممكن يستخدموها من الخارج يعني pharmacologically, and they could mimic the normal cycle. While on the other hand في عندنا سرطانات زي سرطان الثدي زي ما قلنا والبروستات, هذولا they are hormone dependent. في بدايه بالبروستات كانسر مثلا في بداياته بيكون hormone dependent, while in breast cancer لازم تفحص خلايا السرطان انه are they hormone dependent or not. If they are hormone dependent نستخدم لهم هاي الايجنتس الجونادوتروبين releasing hormone agonist or antagonist. في عندنا many products. في عندنا لوبرولايد, جوزيرالين, هذول they are very famous. وزي ما قلنا if you use them in pulsatile fashion يعني in pulses, this mimics the menstrual cycle, while on the other hand if you use them in non-pulsatile fashion they cause or continuous administration they cause inhibition to the system. هلا when they reach a full inhibition potential يعني زي ما قلنا اول اسبوعين releasing hormones gonadotropin releasing hormone would act as agonist, but because of the downregulation of the FSH receptors or gonadotropin releasing hormone receptors بصيروا inhibitory agents. So they cause أعراض انقطاع الدورة اللي هو المينوبوز. So hot flashes or flushes, sweats, headaches. هلا we know إنه بعد انقطاع الدورة يعني إنه بعد menopause like 5 or 10 years ببلش يصير المينوبوزل يعني إنه the chronic menopause complications اللي هو البون loss والosteoporosis والcardiovascular risk factor. يعني بصير في عنا females equivalent to the males with a cardiovascular risk. Men also, if they release those as continuous or they lead to inhibition of the spermatogenesis and testosterone production, they produce similar side effects like hot flushes, sweats, gynecomastia. It reduces libido. It decreases hematocrit, which is like a blood indicator, and they cause reduced bone mineral density. طبعا, on the other hand, also we have gonadotropin releasing hormone antagonists. Okay, so those, they do not produce stimulatory effect during the first 2 weeks, but they cause immediate inhibition. في عندنا ganrelax, citrorelax. So they cause similar side effects to the side effects that we discussed before. Now, another hormone that is produced from the anterior pituitary is prolactin. Prolactin controls, زي ما قلنا, milk production. And in some cancers which produce prolactin or prolactinoma, those would respond to prolactin or dopamine agonists. قلنا إنه dopamine controls prolactin release. It suppresses dopamine release. So they could use bromocriptine. You studied that during Pharmacology 1, which is an anti-Parkinsonian agent. It is used to suppress the prolactin production. Now, prolactin, when it is produced in high levels, it could lead to feedback inhibition to the FSH and LH and gonadotropin release. So this could cause some condition of infertility, and definitely prolactin produces milk, so this could lead to galactorrhea, okay, or increased milk production. Now, زي ما قلنا, posterior pituitary's regulation is different than the anterior pituitary. قلنا في عنا long neuronal cells. The cell body is located in something called paraventricular nuclei. It synthesizes and transports the hormones to the presynapses, and they are released according or when they are needed. المرة الجاية ما بدي حدا يجي بعد الربع، اوكي صبية؟ ولا بدك تتباعدي، تعال هون صبية. Now في عنا two hormones. They are produced from the paraventricular nuclei in the hypothalamus and then released from the posterior pituitary. في عنا hormone اسمه oxytocin, okay, and we have also vasopressin or antidiuretic hormone. Now في عنا structural analog or like a synthetic drug called desmopressin, which is related to the structure of vasopressin. So for desmopressin, it is D-amino, D-arginine, vasopressin. So like one amino group was removed and this L-arginine was replaced by D-arginine. So that's like why they call it DDAVP, anti or arginine vasopressin. So oxytocin is known to be produced بعد الولادة from normal suckling of the يعني nipples by the baby. It stimulates uterine contraction and recovery of the uterine after delivery. Okay, so that's why they favor اللي هو normal breastfeeding بعد الولادة. Okay, إذا كانت الفيميل قادرة على هذا. هلا it could be used intravenously, oxytocin agonist, to induce or reinforce labor. طبعا في عنا أشياء كمان it could induce labor, like في عنا prostaglandins, like prostaglandin I2. It could be used or administered from as a drug to induce labor. طبعا مش عارف إذا بتعرفوا هالشغلة، بس في عنا prostaglandin product اسمه ميزوبروستول. it was used مع الادويه اللي هي تستخدم ل non steroidals. اوكي هلا ميزوبروستول لما ينعطى مع non steroidal الهدف منه انه يعمل ريجنريشن stomach lining بحيث انه non steroidal ما يعمل peptic ulcer. اوكي but this misoprostol was misused and it was used as a like abortion inducer. Okay but misoprostol still is used for induction of abortion. يعني في عندنا protocols for induction of abortion. they are needed اذا كانت وحده معها سرطان لا سمح الله وحامل مثلا ممكن تفكر انها تعمل اجهاض. ليه؟ لانه الكيماوي could potentially adversely affect البيبي. يعني ممكن يعمل teratogenesis او تشوهات خلقيه بالجنين. so البروتوكولات اللي بيستخدموها للاندكشن ابورشن مثلا بيستخدموا دواء للكانسر اسمه ميثوتريكسات. طبعا ميثوتريكسات مش دواء للسرطان بس لحاله، يعني ممكن يستخدم للروماتيزم وبركبوا مع ميزوبروستول. طبعا في many protocols في مايفيبروستول راح نحكي عنه later on. it's a progestin antagonist. it could be used to induce abortion too. so oxytocin زي ما قلنا as such could be used to induce abortion or في آخر يعني I think إنه they begin labor induction إذا الوحدة تجاوزت expected day of delivery by 2 weeks. مش عارف إذا أنتم familiar with this thing إنه when a female is diagnosed يعني إنه أو يعني لما يعرفوا انها حامل مثلا they give her an EDA expected day of or delivery EDD مثلا نحكي. so if she exceeds like the day of delivery by 2 weeks لازم يعملوا induction للليبر يعني انه يساعدوها في اللي هي الولاده. so oxytocin is used in such protocols. Now antagonists زي دواء اسمه اتوسيبان it's used to reduce or delay contractility. اوكي خصوصا اذا كانت الفيميل راح تولد قبل ال 28 to 32nd week. اوكي احنا بنعرف انه الحمل هو عباره عن 40 weeks او بسموه 40 gestational weeks and خصوصا بالبيبيز قبل ال 28 weeks بيكونوا الرئتين بتاعته غير متطورات or underdeveloped. and if a woman is about to give birth during that time بيأخروا الحمل بتاعها وبيعطوها جرعة كورتيزون عشان ينشطوا خلايا الرئتين، خلايا معينة بالرئتين اسمهم alveolar macrophages to start producing pulmonary surfactant اللي هو يعني surfactant you know هاي يعني it is required for normal functioning of the pulmonary alveoli. if the pulmonary surfactant is not there بصير في عند البيبي شيء اسمه if he was delivered بصير في عنده شيء اسمه acute respiratory distress syndrome. so a female that is about to give birth قبل نحكي 32 weeks or 28 weeks 28 to 32 gestational weeks بيعطوها tocolytic agent. حكينا tocolytic isob salbutamol اللي هو البيتا 2 agonist او بيستخدموا الاتوسيبان زائد بيعطوها كورتيكوستيرويد عشان ينشطوا الالفيولار ماكروفاجز to produce السرفاكتنت. اوكي في عندنا بيتا ميثازون ديكساميثازون could be used prednisolone في different يعني agents و different number of doses لهدول الايجنتس. هلا this is for oxytocin for vasopressin او antidiuretic hormone. Now antidiuretic hormone works on the urine or retention mainly through the V2 receptor where it reabsorbs fluids to the kidney يعني بيعمل antidiuretic effect. Okay through the effect on V2 receptor. So now V2 receptors جوا الكلى they do this thing while the V2 receptors outside the kidneys they produce coagulation factors. في coagulation factor اسمه factor 8 وفي فاكتور اسمه فون فيلبراند فاكتور. اوكي، هو بيسموه انتم بتقراوه فون ويلبراند. But this is von Willebrand factor or VWF, which are required for normal coagulation of the blood. Now, deficiency of factor 8 is called hemophilia A. Okay, so it is given in some coagulation disorders, in fact. Now, V1 induces, elevates blood pressure by increasing peripheral vascular resistance or causes vasoconstriction. Now, desmopressin اللي حكينا عنه, it's a structural analog للantidiuretic hormone, is a selective V2 agonist. It is given orally, IV, or intranasally to treat some kinds of complications زي مثلا mild hemophilia A or Willebrand, von Willebrand disease, which is VWF deficiency. And it could be a replacement of antidiuretic hormone in case of lack of production, in case of central or nephrogenic diabetes insipidus. Okay? And vasopressin could be used for treatment of some complications like اسمها دوالي المريء. Okay, دوالي المريء usually أو بسموها esophageal varices بتصير لما liver has a problem and it's not draining blood from the GI tract. فبصير في accumulation of blood at the sites and بيعمل دوالي أو varices. Okay? This is sometimes seen in some chronic liver diseases or يعني لما يصير في تليف للكبد أو hepatitis or liver injury مثلا. Now the antagonists, في عندنا two drugs, conivaptan or tolvaptan. Conivaptan has both V1 and V2 antagonistic effects, while tolvaptan has more selectivity on V2 receptors, and it is used, يعني indicated for hyponatremia or heart failure that are caused by excess of antidiuretic hormone secretion. So this is, يعني لاحظوا إنه this is a very reduced نحكي lecture about pituitary and hypothalamic hormones. They are more complicated than يعني what we have seen. But this is يعني for the purpose of making things easy for you. اتذكروا إنه عملت تعديل أنا للسيلبس إنه الجزء اللي مكتوب عليه رفتو بيكون من الكتاب اللي هو review اللي هو pharmacology examination and board review. Now also يعني إنه راح نحكي عن الثايرويد هرمون. راح تشوفوا إنه the thyroid hormone بالكتاب is divided into two parts, like pharmacology, okay, which we will discuss now, but also we have clinical pharmacology, which is like conditions with increased thyroid hormone and decreased thyroid hormone. We will not study that, okay? اللي هو الكلينيكال pharmacology of يعني مثلا راح نشوف in cancer في أشياء كثيرة مثلا related للclinical pharmacology, but we will not study those now. Okay, so we will study the pharmacology of the agents. Okay. Now, the thyroid gland is a butterfly gland that is located at the back of the neck. Thyroid is a mix of cells with some organization called follicular organization. So they form follicles. Okay. And the follicles surround an opening or a space, and this space contains an agent called thyroglobulin. Okay, and in fact, thyroid hormones, they utilize زي ما قلنا المرة الماضية iodide اللي هو بيكون جاي من سي فود. لهيك انه الناس اللي بياكلوا سي فود that is يعني rich in iodide ما بصير معهم مشاكل بالثايرويد gland. If they don't eat seafood they have a replacement في عندنا iodized products like الملح الميود okay or iodized salt. هلا now not all the cells of the thyroid gland are يعني follicular. في عندنا خلايا اسمها C cells أو the clear cells. C cells in fact they look anatomically or histologically as clear cells but also they are called C cells. يعني ممكن تستفيدوا يعني من هاي أو تربطوها. C cells produce calcitonin. Calcitonin is a major calcium homeostasis regulator or a regulator of homeostasis. في عندنا many agents or like نحكي natural hormones that regulate calcium. مثلا في عندنا زي ما قلنا الثايرويد is like a butterfly. okay في عندنا 4 glands فوقها in the back هذول بسموها الغدة الجارة الدرقية أو parathyroid hormone. Parathyroid gland. Parathyroid gland release also parathyroid hormone, which is very important in regulation of the calcium homeostasis. In general, we have conditions of hypothyroidism in which we have to replace thyroid hormone. Okay, so the most dominant thyroid hormone in the blood is T4 or thyroxine. And this is the one that is available most commonly as a pharmacological product. في عندنا some other products that contain T3, the active form of T4. And we have a mix of T4 and T3, also preparations with a mix of them. Now, hyperthyroidism is a condition that is caused by many conditions or causes. يعني مثلا في عندنا conditions where cancer could release the thyroid hormones. أو في عندنا راح تشوفوا إنه في in the future إنه ممكن يكون في antibodies. Okay, antibodies we know إنه they are immune agents, but they bind to the thyroid receptor, or they thyroid stimulating hormone receptor, and they stimulate thyroid hormone release. So this is like يعني an autoimmune disease which leads to release of thyroid hormone. Cancer زي ما قلنا. في عندنا كمان يمكن we mentioned that يمكن بنت سألتني أو شيء هيك. If the thyroid gland is destroyed by any agent, okay, يمكن ما حكيت لكم هاي الشغلة. When thyroid hormone is synthesized, it is stored in the follicles. When the follicles or the thyroid is destroyed, it releases its contents. Okay, بسموها هاي عاصفة الغدة الدرقية, thyroid storm. And then, if the insult or the cause of destruction is continuously there, بصير في عنا destruction, repair للthyroid gland, and then another time, another phase of destruction. بصير في عنا like variation like that in the thyroid gland. طبعا treatment is to يعني try to remove the offending agent. Sometimes it's a drug induced. Okay, like amiodarone يعني هو دواء أكيد you know إنه cardiovascular drug. It could be used for that situation. For hyperthyroidism, they use agents that block, in fact, the thyroid hormone release. في عنا thiamides, هذول ده most popular. في عنا شيء اسمه Lugol solution in high levels. Iodide could block the utilization and production of thyroid hormone and organification. راح نشوف هذول الخطوات مهمات. هلا لما thyroid hormone يكون released in high levels during thyroid storm يكون في له نحكي beta adrenergic effects. It's an agonist. To control the symptoms بيستخدموا beta blockers زي propranolol. Now إذا كان في عنا سرطان لا سمح الله بالغدة الدرقية ممكن نستخدم اليود المشع to destroy الجزء اللي بالغده اللي هو كانسرس. اوكي ممكن تطفوا التليفونات بليز او اعملوها سايلنت. اوكي سو زي ما قلنا انه في عندنا تو ميجر هرمونز موجودات بالغده الدرقيه. في عندنا تي 4 او الثايروكسين، في عندنا اسمه تراي ايودوثايرونين. ناو كمان الغده بتنتج شيء اسمه ريفيرس تي 3. ناو till now we don't know if it has a function or not, but reverse T3 او بسموه small letter T R T3, so it has no pharmacological effect. And زي ما قلنا clear cells or C cells, they produce calcitonin, and it is important for calcium homeostasis. Now, a good source for calcitonin is salmon, سمك السلمون. So a common formulation of calcitonin is salmon calcitonin. It's used for osteoporosis أو تنخر العظام. هلا زي ما قلنا إنه this is the thyroid gland. Thyroid gland picks up iodide. وهون لازم ننتبه إنه I minus is iodide while I2 is iodine. Okay? So iodide is picked up from food or from circulation, and it comes from food, and it is transported across the follicular cells. So the follicular cells will transport it first through the apical side, and then they transport it inside the follicle. قلنا طبعا this is not a true drawing. The true drawing إنه ترسم follicular cells like that, forming a follicle and a lining inside of them. Okay, so here inside في عندنا polymer من التيروسين اسمه thyroglobulin. So iodide زي ما قلنا is transported across the two membranes. Across the first membrane, this is mediated by a transporter called sodium iodide symporter. Symporter means transport to the same site concomitantly. If we have like this receptor, if it is transporting two electrolytes or substances together, okay, this is called symporter. If it is transporting them against each other or عكس بعض يكون اسمه antiporter. زي الصوديوم بوتاسيوم الصوديوم بوتاسيوم ATPase pump. أو an example of symporter, we know إنه glucose is transported together with potassium. اوكي عشان هيك في اذا كان في عند الواحد هايبر كاليميا ممكن يستخدموا له glucose and insulin to lower الهايبركاليميا in fact. The second transporter is called pindrin, and pindrin deficiency or malfunction is linked to some genetic disease حتى associated with deafness or a problem with thyroid function. Okay, so pindrin deficiency is associated with thyroid abnormalities together with deafness اللي هو الطرش. Now, when it is transported, في عندنا شيء اسمه TPO or thyroid peroxidase. It will convert iodide to organic iodide, and then it will incorporate it بالpolymer of tyrosine. Now, tyrosine, if it is a polymer, بيكون N C وبيكون في عندنا tyrosine like that with an OH, and then CO اللي هو peptide bond to another tyrosine. So iodide, it's either attached attached once, or this is called monoiodotyrosine, or it is attached twice, or like two molecules of iodide are attached to one residue of tyrosine. This creates diiodotyrosine. So monoiodotyrosine and diiodotyrosine. And then those would be combined with each other, and this is called coupling. Two DITs, diiodotyrosine مع diiodotyrosine, forms T4, while monoiodotyrosine with diiodotyrosine, it gives either T3 or reverse T3. هسا, I don't know if monoiodo is combined with monoiodo, but like this is how we form T4 and T3. هلا T4 and T3 they remain بالpolymer attached, and then بصير في proteolytic degradation للthyroglobulin اللي هو processed thyroglobulin, and this creates a pool of T4 and T3 that are released on demand. يعني when the body needs them, they are released. هلا when they are released by proteolysis زي ما قلنا, they circulate. The major circulating hormone is T4 اللي هو thyroxine. When it reaches the peripheral tissue, T4 is the less active form. It needs to be converted to T3. This is done by an enzyme called 5' deaminase, deiodinase, sorry. And like this could either give T3 or reverse T3 similarly. And this is like the active form of T3. Like now, definitely hypothalamus is regulated by feedback inhibition, or hypothalamic, pituitary, and thyroid. They are regulated by feedback inhibition. T4, T3 normal levels would lead to inhibition of the hormones اللي بينفرزوا من الhypothalamus and pituitary. Hypothalamus releases thyrotropin releasing hormone to stimulate the anterior pituitary to release TSH, which is the thyroid stimulating hormone. And thyroid stimulating hormone goes to the thyroid gland, stimulates T4 and T3 release. هلا في عندنا many conditions or regulators للinduction of release of TSH. زي مثلا exposure to cold or psychosis, or it's part of the circadian rhythm to release T4 and T3, while severe stress could lead to inhibition of the system. في عندنا also corticosteroids and dopamine could inhibit the release of TSH from the anterior pituitary. في عندنا somatostatin. قلنا إنه somatostatin, which is used to inhibit growth hormone. Also, it could regulate many hormones in the system, gastrin, glucagon, insulin, but also TSH. And also, if you provide iodide from an external source, يعني in normal moderate levels, it stimulates the thyroid hormone function لأنه بتحول ل T4 and T3. But في عندنا high levels of iodide, يعني زي ما شفنا بالflow chart here, in local solution, it leads to inhibition of the hormone release. Okay, so iodide could have dual effects. Low levels stimulates, high levels suppresses thyroid hormone function. هلا في عندنا many transporters for T4 and T3. T4 and T3 they have low solubility in the blood, so they need transporters. The main transporter is an agent called thyroid binding protein, or thyroid binding globulin. Now, thyroid binding globulin, if it was available in high levels, it leads to more T4, T3 bound and less release. So, يعني ممكن نحكي إنه things that control the production of thyroid binding protein or globulin could really lead to change in the function of those agents. هلا example عليها إنه في عندنا estrogen could stimulate the liver to produce more binding globulins. Okay, so like this is just one remark. هلا for this في عندنا two therapeutic potentials for the thyroid gland. يا اما we give thyroid hormone agonist or replace اللي هو deficiency. And we have also the anti-thyroid agents. نسيت احكي لكم هاي الشغله. يعني مثلا نفترض انه في واحد عنده لا سمح الله سرطان بالغده الدرقيه. اوكي، في لها علاجات، مشع، ايودايد مشع، او انهم يستأصل جزء من الغده. هلا when they do that هلا يا اما الجزء remaining function of the thyroid would be normal، يعني ممكن يفرز T4 and T3 in normal level، او انه ببطل يكون normal. So you have to give them T4 and T3 from external sources. هلا كمان ممكن تواجهكم هاي المشكله انه in real life في عندنا شيء اسمه TSH levels with T4 with free T3 T4 those things. هلا free T4 زي ما قلنا اللي هو not bound للثايرويد binding protein okay which is a regulator للfunction تاعته is more important predictor للfunction of T4 free T4 okay this is a better predictor of the function. Also TSH لما يكون normal this means that the situation is okay but sometimes يكون في عندنا TSH low but يعني ممكن يكون في عندنا اختلالات بالT4 أو T3. This is called sorry بيكون TSH low but T4 and T3 are normal. This is called sub-acute أو you know like you could say before يعني لما before the complications تبلش this is called sub-acute hypothyroidism okay يعني before إنه تبلش complications. So you have to not interpret results quickly يعني because يعني في عندنا ممكن يكون في عندنا many complications coming from that. هلا in general لما thyroid gland is not efficient in production of T4 this is called primary hypothyroidism. إذا كانت المشكلة بالanterior pituitary this is called secondary hypothyroidism. إذا كانت المشكلة بالhypothalamic this is called tertiary hypothyroidism. So also you should be familiar with the terms. هلا زي ما قلنا انه الثايرويد هرمونز في عندنا T4 which is the major circulating agent or hormone. في عندنا T3 the most active but less circulating. وفي عندنا reverse T3 it is inactive. هلا like other like compounds in the body it is metabolized deactivated but some agents could deactivate T4 and T3. It could deactivate it as a like natural compound released from the body or as an exogenous or a drug. So like for example rifampin, phenobarb, carbamazepine, phenytoin, tyrosine kinase inhibitors هذول بيستخدموا للcancer or some other conditions or HIV protease inhibitors هذول بيستخدموا للAIDS مثلا. Those are all enzyme inducers to the drug. هلا for the thyroid hormone the mechanism of action انه when the receptor of the thyroid hormone is not occupied okay you should know first انه we have two types of receptors. في عندنا receptors that are on the surface and we have receptors that are found in the cytosol or the nucleus okay so estrogens progestin testosterone الريسبتور بتاعهم موجود بالسيتوسول while for example زي ما حكينا growth hormone لانه peptides have high water solubility الريسبتور بتاعه موجود في على السيل سيرفيس اوكي استروجين بروجستين تستوستيرون الريسبتور بتاعهم موجود في السيتوسول while T4's receptor or مش راح يكون T4 لانه راح يتحول ل T3 in fact يعني لما يدخل T4 جوا الخليه بتحول ل T3 first then it goes to the site of action which is the receptor that is found in the nucleus. Now the inactive unoccupied receptor form بيكون thyroid receptor مرتبط as a dimer يعني لو وحده مشابهه له بالشكل اوكي مرتبط بالبايندينج سايت له على الدي ان اي. البايندينج سايت على الدي ان اي بسموها ريسبونس element. for thyroid hormone او thyroid receptor بسموها thyroid response element. مثلا for estrogen response element okay or corticosteroid response element CREs. اذا في عندنا no T3 in the nucleus. It's not bound to the receptor. الريسبتور بيكون عباره عن dimer of the same subunits. Okay, like that. وبيكون مرتبط باشياء بتثبطه اللي هي اسمها co-repressors. Now, when T4 arrives at the cell, بتحول first ل T3 by زي ما قلنا 5 prime deiodinase. بعدين ال T3 بيدخل جوا بيرتبط بالريسبتور بتاعه. في عندنا 2 subunits للريسبتور. وحده مرتبطه بالدي ان اي اسمها ثايرويد ريسبتور دي ان اي بايندينج دومين، والوحده اللي بيرتبط فيها اللايجند اللي هو تي 3 بيسموها ثايرويد ريسبتور لايجند بايندينج دومين. بينفك الوحده اللي بتشبهه اللي هو ثايرويد ريسبتور يونت ديتاتشز مع الريبريسرز او الكوريبريسرز، وبيرتبط شيء اسمه ار اكس ار ريسبتور اللي هو الريتينويد اكس ريسبتور بيرتبط. اوكي، وتريكروت something called co-activators. It's a little bit complicated يعني بس this is like the mechanism. هلا when the thyroid response element detects the active form of the receptor بصير يشتغل as a يعني بصير في transcription للجينز linked to the response element. The major product that is expressed هو الصوديوم بوتاسيوم انتي بورتر اللي حكينا عنه اللي هو بيسموها صوديوم بوتاسيوم ATPase pump. صوديوم بوتاسيوم ATPase pump هاي مسؤولة عن النورمال voltage difference across the cell. هلا one other factor لازم تعرفوه انه any mechanical system يعني لو تشغل مضخة عندكم بالبيت مثلا بتحمى بصير في حرارة بتطلع منها. اوكي. Now, this sodium potassium ATPase pump also produces some heat as a byproduct لل pumping action. And الحرارة اللي هي موجودة اللي بتنتج من الريسبتور هي مسؤولة عن تقدر تحكوا إنه thermogenesis أو formation أو production of heat in our body. بحيث إنه إذا كان في an increased function للثايرويد هرمونز، إذا كان في عند واحد ثايروتوكسيكوسيس أو فرط في افراز الغده الدرقيه بسبب زياده الاكتيفيتي اوف this receptor system، يكون الواحد من الاعراض بتاعت الثايرويد توكسيكوسيس انه عنده حراره عاليه يعني او البادي تمبرتشر تكون elevated او بيحسوا انه حامي كثير. now في many complications او side effects او symptoms زياده افراز الغده الدرقيه ونقصها. مثلا من الاشياء اللي معروفه اكيد يعني you know it انه مثلا it causes retraction of the upper eyelid and بصير في exophthalmosis يعني العين بتطلع من السوكت بتاعتها. اوكي and this is called exophthalmosis أو جحوظ العينين. يعني this is one complication of thyrotoxicosis. بيقولوا إنه الشاعر الجاحظ إذا بتعرفوه like he had thyrotoxicosis and that's like he got this name from this يعني this symptom. هلا historically الثايرويد كانت thyroid hormone replacement therapies كانوا يستخلصوها يا اما من حيوانات او وبعديها they started synthesizing compound. يعني T4 T3 synthesis is a piece of cake مقارنه بالsynthesis of estrogen which is for a while كان يستخدموا نحكي external sources for estrogen. Okay, like estrogen is found in high levels in urine of horses or pregnant men, pregnant horses. But when they perfected the synthesis, they started producing it commercially. Okay, إذا في products يعني بيستخدموها مستخلصة من urine of animals or humans زي ما قلنا. But يعني مثلا نحكي when they started synthesizing thyroid hormone صاروا يستغنوا عن definitely they discontinued any products extracted from animals لأنه في عندها ممكن تسبب side effects like تحسس بسبب البروتينات الفورين اللي هو موجوده، او انه مثلا كميه الثايرويد هرمون ما بتكون مثلا fixed in them. That's why they don't use animal sources like for T4 or T3 anymore. هلا في حد عنده سؤال لحد هون؟ هلا زي ما احنا بنعرف انه في اي حاله مثلا ممكن تشوف انه في التي 4 او التي 3 هرمونات هاي الغده الدرقيه ممكن تعطيك beneficial effects مثلا. يعني مثلا اذا اخذت تي 4 بتزيد حرق البيزل ميتابوليك ريت او معدل الايض في الجسم، ممكن تحرق دهون كثير. ممكن تي 4 بيستخدموها فور ويت ريدكشن مثلا، هاي طبعا off label and it is not even recommended to do that. زي مثلا في ناس بيستخدموا الجلوكوفيج او منظم السكر، مر عليكم بوست منسف مر عليكم؟ يعني بعد المنسف مثلا انه بيكون عنده حبه 58 بعد المنسف باخذها عشان يخفف تاثيرات زياده الجلوكوز من المليحيه او من المنسف. So those are يعني كمان الميتفورمين also is capable of in fact weight reduction. ماشي. corticosteroids they also cause مثلا نحكي weight gain. So يعني مثلا it is an off-label use but it's not recommended to use that. So T4 also it has some tumor suppressing effects. هلا بيستخدموها mainly بشيء اسمه polycystic ovarian syndrome او تكيس المبيض اللي هو polycystic ovarian syndrome. هاي this is an يعني although it is off label but it is an indication. في research بيشوف انه تاثيره على هاي انا بحكي عن الميتفورمين of course يعني مش الثايرويد هرمون. اوكي. So الميتفورمين has many indications like anti-cancer للpolycystic ovarian syndrome. Also حتى لو الواحد ما معه سكري في condition اسمها pre-diabetes ما قبل السكري، زي ما هو في عندنا pre-hypertension في عندنا شيء اسمه pre-diabetes. لو تشوفوا يعني السكري بتتشخص بعد 6.4 سكر تراكمي او hemoglobin A1C. من 5.8 ل 6.4 you could say انه this is called pre-diabetes. If pre-diabetes continues, you remain like with poor control of your glycemic habits or glycemic control. When it exceeds 6.4 خلص بصير في عندك diagnosis ل diabetes and you have to receive drug therapy. وموستلي البنكرياس بتصير non-responsive يعني مثلا للجلوكوز variations. So in pre-diabetes في عندك a couple of drugs that could reverse this situation or condition. اللي هو واحد منهم الميتفورمين could be used for pre-diabetes. هلا اذا يعني في عندنا many indications like thyroid preparations off label مثلا weight reduction, abnormal vaginal bleeding or depression. يعني those are some off-label use, but you cannot use thyroid preparations unless يعني it is under medical supervision. حتى يعني مش عارف it is not mentioned in the book, but you cannot switch from one T4 preparation or thyroxine preparation to the other unless يعني under medical supervision. لأنه الcontent biodisposition, absorption, distribution, metabolism, excretion of the preparation varies from one preparation to the other. إذا بلشت على product ثاني لازم تعمل stabilization للنيو يعني steady state levels لكل الأدوية. هلا الليفوثايروكسين أو T4 it is the drug of choice for many indications. Because يعني مثلا if you compare T4 to T3 بتلاحظ انه T4 has reduced يعني activity مش that much potent, okay, but it has controlled activity, while T3 has نقدر نحكي super activity, okay. It could T3 if it is given, it could cause مثلا cardiac stimulation يعني or نحكي like arrhythmias or cardiac instability, okay. So they prefer in fact T4 over T3, okay. Content uniformity compared to the animal products. It is highly stable كمان. Half-life تاعته longer than T4 and T3, like than T3 or than animal sources. It is also have low cost, no allergic foreign proteins as the animal sources or T4 from animal sources, and easy to measure serum levels compared to the T3, and it has long half-life زي ما قلنا compared to the T3. Now T3 has a shorter half-life. It requires multiple daily dosing, in fact per day. It has high cost. زي ما قلنا, it could cause some cardiac stimulation or complications if it was given, and it is very hard to measure serum levels for T3. In fact, it is only indicated for short-term suppression of TSH. يعني it is rarely used, but the one that is most commonly indicated is T4. هلا thyroid hormone from animal sources is referred to as desiccated thyroid, and it has many complications, and they stop using it. When you give T4 or convert from T4 T3, you should know the equivalent doses. يعني 100 milligram of desiccated thyroid اللي هو from natural sources is equivalent to 100 micrograms of levo T4, and it is equivalent to 37.5 micrograms of T3. Now, the anti-thyroid agents, زي ما قلنا, they are multiple. في عنا the most common are thiamides, propylthiouracil, methimazole and carbimazole. في عنا anion inhibitors, perchlorate, perticnate, يعني multiple ones of them. هلا الايودايدز زي ما قلنا in high levels in a preparation called Lugol solution, it is used to suppress the thyroid hormone function. هلا radioactive iodine is divided into two parts. One that is produces gamma radiation. This is mostly used for diagnosis. يعني بيعطوه شربة يود مشع بس بينتج جاما زي الايد 123, وبصوروا الغده الدرقيه. هاي الغده الدرقيه that emits more gamma radiation معناها الفانكشن تاعتها اعلى من ال other parts of the thyroid gland. هلا لما يصوروا الغده الدرقيه يا اما بيكون في عندنا follicular pattern او diffuse pattern. diffuse pattern mostly يعني this is normal, okay. او اذا كان في عندنا زياده افراز غده درقيه بيكون كل الغده الدرقيه involved with high thyroid function activity, يعني لازم you should remove it. While follicular could mean some areas are responsible for that. على الاغلب يعني بيستأصلوا الاماكن اللي بيكون في عندها زياده او فرط في افراز الغده الدرقيه. اوكي could be cancer مثلا لا سمح الله. هلا الشيء الثاني اللي هو that emits beta particles. Beta particles are destructive لل surrounding tissue. And this is I-131 يعني اللي هو الرقم بتاعها. So beta particles would destroy local tissue. Okay? الرقم الذري يسموه. Now those drugs زي thiamides هدول they suppress thyroid function, but they require more than like 5 to 7 days to function. واذا كان واحد عنده اختلالات في مثلا زياده فرط في افراز الغده الدرقيه, يكون في عنده cardiac complications, tremors مثلا, يصير يعني مثلا اذا بتطلب من مريض الغده الدرقيه مد ايده like that بيكون يعمل like he would have tremors. Okay, so tremor is not something like that is major, but cardiac stimulation or potential for heart failure هاي المشكله. So to act fast, control the symptoms of hyperthyroidism, they give beta blockers, and they prefer the non-selective beta blockers اللي هو mainly بيستخدموا propranolol. هلا thiamides في عندنا multiple agents. في عندنا مثلا the most popular propylthiouracil، في عندنا methimazole also، وفي عندنا carbimazole which is not used in US, only in UK. ممكن يكون عندنا بالأردن إحنا كمان. Now the mechanism of action is related to the thiocarbamide group بتاعته, which would lead to its functions. يعني في عندنا multiple functions ل thiamides. First, they inhibit thyroid peroxidase or TPO enzyme. Thyroid peroxidase قلنا مسؤول عن organification, and also it contributes to the iodination of thyroglobulin. يعني أول شيء خطوة الorganification، وثاني خطوة اللي هي اللي هو incorporation with thyroglobulin to form MIT اللي هو المونوiodotyrosine with diiodotyrosine. هلا also it could inhibit the coupling of DIT مع DIT to form T4 or MIT مع DIT to form T3 or reverse T3. هلا propylthiouracil mainly يعني واكثر من الميثامازول it inhibits the peripheral conversion of T4 to T3 في انزيم اللي قلنا عنه 5 prime deiodinase اللي بيشيل الايودايد من ال T4 بيحوله ل T3 or reverse T3, and this is responsible for the activation of the T4. هلا البيك افكت بتاعتهم يعني it begins على 7 days or 5 to 7 days, but يعني it takes a long time for them to be يعني fully functional. عشان هيك بيستخدموا زي ما قلنا ال symptom control agents like beta blockers to control the symptoms. هلا propylthiouracil it causes severe hepatitis, and that's why it's not the drug of choice for management of hyperthyroidism patients. They use or prefer methimazole. It's the drug of choice in adults and children. But propylthiouracil is more safe in pregnant women, and that's why it's the drug of choice, especially during the first trimester. Okay. Also, propylthiouracil is the drug of choice في حالة الثايرويد ستون أو العصفة الغدة الدرقية. قلنا thyroid stone comes from يعني مثلا drug induced or autoimmune destruction of the thyroid gland where thyroid hormones are dumped, يعني إنه زي ما نحكوا تنرمى بالcirculation. So now methimazole could cause agranulocytosis and sometimes hepatitis. If a patient is on methimazole and then he develops those side effects, and تخيلوا agranulocytosis, يعني he will not produce granulocytes, which are neutrophils, eosinophils, basophils. Now, neutrophils are major combatants of bacterial infections. يعني agranulocytosis is a condition of reduced immunity. So in that situation, you could switch from methimazole to propylthiouracil. خلينا نكمل المرة الجاي. خلينا بس نحكي عن السايد افكتس تاعتهم. زي ما قلنا السايد افكتس تاعتهم هي عبارة عن propylthiouracil بسبب severe hepatitis. They could cause nausea, GI distress, altered sense of taste or smell, mostly because of methimazole or caused by methimazole. في عندنا maculopapular pruritic rash, يعني انه some kind of form of rash with pruritus pruritic effect يعني مع حكه and fever. They could cause rarely urticarial rash, vasculitis, lupus-like reaction, lymphadenopathy يعني swelling of the lymph nodes, hyperprothrombemia, hypoprothrombemia, exfoliative dermatitis يعني انه skin condition with exfoliation which is shedding of the skin يعني بصير يقشر الجلد. Polycerositis which is inflammation of the serous tissue in the abdomen, and acute arthralgia. زي ما قلنا انه propylthiouracil has more tendency to cause acute hepatitis, and that's why it has a black box warning على البرودكت بتاعه. أي product with a black box warning, this means that it has a serious complication or side effect, like something that could lead to hospitalization, mortality. يعني definitely you discussed that in some courses. Also, it could cause cholestatic jaundice, but this is more in methimazole. So cholestatic jaundice means that this is caused by the reduction or obstruction of the biliary duct, okay, which leads to accumulation of bilirubin and jaundice, which is اللي هو الاصفرار. وزي ما قلنا agranulocytosis, which is diagnosed as granulocyte count less than 500 cells per millimeter cube. This is more encountered in older patients and patients receiving a high dose of methimazole, more than 40 milligrams per day. Okay, هيك نحكي خلصنا المحاضرة لليوم.